Welcome to Learning Anatomy with Dr. Bakari. And if you are visiting this space for the first time, you are also highly welcome. In this lecture, we'll be looking at the superior gluteal artery. The superior gluteal artery is one of the branches from the posterior trunk of the internal iliac artery. I'll put up a lecture on the internal iliac artery. If you've not checked up that lecture, please kindly go and do so. In that lecture, we described how the superior gluteal artery emerges. But for the purpose of this class, we would be focusing or dwelling more on the superior gluteal artery, and we'll be describing the path that it runs from where it emerges and also the different branches that it gives along that course. The superior gluteal artery, we say that it is one of the branches of the internal iliac artery, but specifically it is seen to emerge from the posterior trunk of the internal iliac artery. So let's see how this artery emerges using this image by the side. This structure that is harrowed here in black is the abdominal aorta. We know that the abdominal aorta at the level of the fourth lumbar vertebra would be seen to bifurcate into the common iliac arteries. So at this level here that is highlighted in dotted yellow, we have the abdominal aorta bifurcating into the common iliac artery on one side and also on the other side. So we have the right and the left common iliac arteries, and this is what is harrowed here in black. This common iliac artery is also seen to further subdivide into the internal iliac artery that is harrowed here at this point, and also the external iliac artery. The internal iliac artery is directed towards the pelvic cavity, while the external iliac artery is directed towards the lower limb. And this is where to be supplying structures around that region. So for the internal iliac artery that is harrowed here in black, that is seen within the pelvic cavity, this is also further subdivided into two trunks. So we have the anterior trunk here at the front, and behind we have the emergence of the posterior trunk. So you have two trunks emerging from the internal iliac artery, and this is where the branches, of course, emerge from. So for the anterior trunk, we have a number of branches emerging from the anterior trunk. This we have highlighted in our previous lecture on the internal iliac artery. So for the posterior trunk, which is where we have the emergence of the superior gluteal artery, we also have a number of branches emerging from this posterior trunk, and this includes the iliolumbar branch and also the lateral sacral branch. So these two branches will emerge from the posterior trunk of the internal iliac artery. After this emergence, the posterior trunk is seen to then further proceed in its journey to become the superior gluteal artery. And this is what is highlighted here in pink. So we can say that the superior gluteal artery is a continuation of the posterior trunk of the internal iliac artery, even though it can also be stated as one of the branches of the posterior trunk of the internal iliac artery. So it depends on the text that we are reading. It can be stated that it is a branch of the posterior trunk, which of course is actually true. And it can also be stated as a continuation of the posterior trunk of the internal iliac artery, because we see that the posterior trunk of the internal iliac artery is seen to have given off two branches before it finally becomes continuous as the superior gluteal artery. So it's good for us to understand the basis behind these two statements. So the superior gluteal artery is what is seen to be harrowed here in yellow. The superior gluteal artery is the largest branch of the internal iliac artery. When all the branches of the internal iliac artery, which are branches that emerge from both the anterior and the posterior trunk, are put together, we can see that the superior gluteal artery is the largest in terms of caliber of all these branches. So we say that it is the largest branch of the internal iliac artery. So let's drive further to see the course that it runs from where it emerges from the posterior trunk of the internal iliac artery. Let's see how it proceeds in its journey. So the course that it runs first within the pelvic cavity, we know that the superior gluteal artery emerges from the posterior trunk of the internal iliac artery. We can also say that it is a continuation of the posterior trunk of the internal iliac artery. We've tried to explain and also illustrate how these two statements are drafted. So let's see the structures that are related to the superior gluteal artery within the pelvic cavity. So upon its emergence, it is directed posteriorly. So if you try to use this image to illustrate how it runs within the pelvic cavity, this is where we have the lumbosacral trunk here, highlighted in yellow. The lumbosacral trunk is the anterior rami or the ventral rami of L4 and L5 nerve, And this is what is highlighted here in dotted yellow. And if you go more inferiorly, you have the ventral rama of the first sacrospinal nerve, you have the ventral rama of the second, the third, and also the fourth sacrospinal nerves. All these nerves are seen to contribute to the formation of the sacral plexus. We've also tried to highlight this in our lecture on the sacral plexus. If you've not checked out that lecture, please kindly go and do so. So the sacral plexus is seen to be created around the posterior lateral region of the pelvic cavity. And this is what is highlighted here in this image. So you have the lumbosacral trunk here highlighted in dotted yellow at the superior edge, where at the inferior edge, you have the ventral rami of S1 to S4. So you see that after the emergence of the superior gluteal artery, it is seen to pass between the lumbosacral trunk and also the ventral rami of S1. And this is what is highlighted here in pink. And this is how it runs within the pelvic cavity. Within this space, it is seen to give off 3 branches. So it's seen to give off a branch to the piriformis. This is where we have the piriformis here, highlighted in green. We know that the piriformis has its fibers originating from the anterolateral surface of the sacrum, and the fibers are directed through the greater sciatic foramen. And this is where it exits the pelvic cavity to be inserted on the greater truncator of the femur. So we have the piriformis here highlighted in green, and you see that the superior gluteal artery is then seen to give off a branch to the piriformis. We also have a supporting branch that it gives to the obliterator internus muscle. This is where we have the obliterator internus muscle at this inferior lateral end. And you also see that the superior gluteal artery is giving off a branch to supply this muscle as a contributory branch. The final branch that it gives within the pelvic cavity is a nutrient branch that is directed superiorly towards the ilium. This is where we have the ilium at the superior edge, and you have the nutrient artery that is supplying the ilium around this posterior region. And after giving up these 3 branches, the next course of the superior gluteal artery is for it to exit the pelvic cavity, because the structures that it is destined or programmed to supply are located around the gluteal region. If you look at the name of this vessel, the superior gluteal artery, so it is programmed to supply muscles around the gluteal region. So you see that this vessel will need to exit the pelvic cavity so as to be able to access the gluteal region. So let's drive through the next slide where we'll be establishing how it exits the pelvic cavity. So the superior gluteal artery is seen to exit the pelvic cavity through the suprapiriform foramen. The suprapiriform foramen is a subset of the greater sciatic foramen. And we'll be using the images on this slide to describe how the suprapiriform foramen is formed. If you try to use this image by the side here, this is where we have the superior gluteal artery. The superior gluteal artery, we say that it's an emergence from the posterior trunk of the internal iliac artery. It can also be stated to be a continuation of the posterior trunk of the internal iliac artery. After its emergence within the pelvic cavity, we have highlighted the branches that it gives within the space. And this is where it is then directed above the piriformis. So you see that after giving up these branches within the pelvic cavity, the direction of this vessel is towards the superior region of the piriformis. Remember, this is where we have the piriformis here, arrowed in white. This piriformis muscle is also seen to pass through the greater sciatic foramen. And this is what is responsible for dividing the greater sciatic foramen into the supra and the infrapiriform foramina. Let's try and use this image by the side to further explain how we have the emergence of the suprapiriform foramen. This is where we have the greater sciatic notch that is highlighted here in dotted black. This greater sciatic notch is an indentation that is created on the ilium. This indentation is further transformed into a foramen by the sacrospinous ligament. This is where we have the sacrospinous ligament here, highlighted here in blue. This sacrospinous ligament, as I've always said on this channel, is for us to always break down the name. Sacrospinous ligament means a ligament that is seen to connect the spine of the ischium to the sacrum. And you see it running to and fro these 2 subpoints. And this is where it is seen to transform this notch that is highlighted here in dotted black into a foramen. So we have the creation of the greater sciatic foramen here highlighted in yellow. So this foramen is so created to allow for the passage of structures. This foramen also creates a passageway for the piriformis muscle. The piriformis muscle is what is seen to be arrowed here in yellow. And we have the fibers of the piriformis originating from the anterolateral surface of the sacrum. This is where we have the sacrum here. And the fibers are directed through this greater sciatic foramen that is highlighted here in yellow. After its passage through this foramen, the fibers are directed laterally where they'll be inserted on the greater truncator of the femur. But if you drive back to the part that it runs within the greater sciatic foramen, you see that this pattern then leaves the greater sciatic foramen divided into two subforamina. So you have a foramen created superior to the piriformis, although still within the greater sciatic foramen. And this is what is harrowed here in purple. And this is referred to as the suprapiriform foramen. It is suprapiriform foramen because it is a foramen that is created superior to the piriformis. And this is how the name is being drafted. If you also go more inferiorly at the inferior edge, you also have a foramen created at this point that is harrowed here in red. This foramen is positioned inferior to the piriformis, although still within the greater sciatic foramen. And this is referred to as the infrapiriform foramen, which is a foramen that is created inferior to the piriformis. So this is how we have the piriformis muscle further subdividing the greater sciatic foramen into the supra and the infrapiriform foramina. So going back to the exit of the superior gluteal artery, we say that the superior gluteal artery, we need to pass through the greater sciatic foramen before it can exit the pelvic cavity. And if you drive through how the piriformis then further subdivides this foramen, you see that the superior gluteal artery will either need to run through the supra or the infrapiriform foramen. So you then see the superior gluteal artery passing through the suprapiriform foramen. And this is how it exits the pelvic cavity, which of course is a subset of the greater sciatic foramen. So this is how it exits the pelvic cavity. And upon this course, you then see the superior gluteal artery positioned within the gluteal region. So let's drive further to see what happens to these vessels within the gluteal region. So upon exiting the pelvic cavity, the superior gluteal artery, we say, is seen to be positioned in the gluteal region. And in this space, it is seen to be subdivided into superficial branch and also the deep branch. So we have two branches emerging from the superior gluteal artery upon its exit. The superior gluteal artery, upon its exit, is seen to be divided into the superficial branch and the deep branch. Let's try and use this image by the side here to establish this. This is where we have the greater sciatic foramen here, highlighted in dotted red. We already established this foramen in our previous slide. This foramen is created to allow for the passage of structures. It is through this foramen, specifically through the suprapiriform foramen, that we have the exit of the superior gluteal artery. And this is what is established here at this point. This superior gluteal artery is then further subdivided into a deep branch that is highlighted here in yellow. This deep branch, just as the name implies, is seen positioned deep within the gluteal region. And it is located between the gluteus minimus and also the gluteus medius. This is the gluteus minimus here, highlighted in red. The gluteus minimus is the deepest muscle around the superficial gluteal space. And this gluteus minimus is overlined by the gluteus medius. This is the gluteus medius here that is highlighted here in green. So the deep branch of the superior gluteal artery is sandwiched between the gluteus minimus and the gluteus medius. And this is what is expressed or represented here in this image. When the superficial branch is what is highlighted here in pink, this superficial branch, just as the name implies, is seen to run superficially, and it is seen to be positioned between the gluteus medius and also the gluteus maximus. This is where we have the gluteus maximus here, highlighted in purple. The gluteus maximus is seen to be overlying on the gluteus medius. But I try to use this other side of the image so as to keep this artery exposed. So you see this gluteus maximus highlighted in purple placed on top of the gluteus medius. And by doing so, we see the superficial branch of the superior gluteal artery sandwiched between gluteus medius and also the gluteus maximus. So if you try to put this gluteus maximum on top of this, this is what is going to be exhibited. So we see that the superficial branch and the deep branch of the superior gluteal artery are so sandwiched between the gluteal muscles. And this is what is represented here in this image. So for the superficial branch that is superficially placed So placed between the gluteus maximus superficially and also the gluteus medius that is positioned deep to the gluteus maximus. You see that it is seen to supply the gluteus maximus and also the gluteus medius. So this superficial branch here that is highlighted here in pink is seen to give off branches that will be supplying oxygen and also nutrients to the gluteus maximus that is overlying on this, and also the gluteus medius that is located deep to it. So this is how the superior gluteal artery is seen to provide supply to both the gluteus maximus and also the gluteus medius. So let's drive through the second slide to establish the branches and also the muscles that the deep branches of the superior gluteal artery will be supplying. So for the deep branch, we already established in our previous slide that we have the greater sciatic foramen. This is what is highlighted here in dotted red. This greater sciatic foramen will give a passageway for the superior gluteal artery. And this is what is highlighted here at this point. This superior gluteal artery, we say that it will be giving off a superficial branch that is highlighted here in pink, and this is superficially placed. Also a deep branch that is highlighted here in yellow. We've tried to highlight or establish the different branches and also muscles that the superficial branch of the superior gluteal artery will be supplying in our previous slide. So for this slide, we will be focusing on the deep branch of the superior gluteal artery. So this is where we have the deep branch of the superior gluteal artery highlighted in yellow. This deep branch is further subdivided into a superior branch. This is the superior branch here highlighted in blue. The superior branch, just as the name implies, is directed superiorly. So you see it tailing towards the superior region of the gluteal region. And we have an inferior branch that is directed inferiorly. And this is what is highlighted here in purple. So you see that the deep branch of the superior gluteal artery is further subdivided into a superior branch and an inferior branch. The superior branch is seen to ascend upward, and this is where it's seen to form anastomosis with branches from the lateral circumflex femoral artery and also the deep circumflex iliac artery. And this is what is created here at this point. And this is what is represented here in dotted white. So you see it at that superior head, creating anastomosis at the upper region of the gluteal space. The inferior gluteal branch that emerges from the deep branch of the superior gluteal artery is seen to be sandwiched between the gluteus minimus and also the gluteus medius. And this is what is highlighted here in purple. We already said that the gluteus minimus is the deepest, and this is overlined by the gluteus medius. So if you have the gluteus medius, then overlying this, you then see that the inferior branch will be sandwiched between the gluteus medius and also the gluteus minimus. We also tried to illustrate this a bit in our previous slide. And this inferior branch is seen to give off a number of branches. Remember, we have a muscle at this lateral edge. This muscle is referred to as the tensor fasciae lata. This is what is highlighted here in yellow. This is one of the superficial gluteal muscles, and it is located around the lateral edge of the gluteal region. And this is how it is positioned around this space. So you see that this inferior branch will be giving off supply to the gluteus minimus that is highlighted here in red, and also a branch to supply the gluteus medius that is highlighted in green. Remember, we said that the gluteus medius in our previous slide, highlighted in green, we seem to be overlying on the gluteus minimus. And this is where it gives off a branch to also provide supply for that muscle. Then finally, you see an emergence from this inferior branch, also supplying the upper region of the tensor fasciae lata. So these are the three branches that would emerge from the inferior branch, from the deep branch of the superior gluteal artery. Remember that the superior gluteal artery will further subdivide into the superficial and also the deep branch. It is the deep branch that will then further subdivide into the superior and the inferior branches. And this is what we try to highlight using this slide. So you see that the inferior branch, which emerges from the deep branch of the superior gluteal artery, will be seen to provide supply to the gluteus medius, the gluteus minimus, and also the upper region of the tensor fasciae lata. And at the end, you see that this vessel will finally be seen to form anastomosis around the truncateric region. Around the region of the truncator of the femur, you see that it will be creating anastomosis with the lateral circumflex femoral artery and also the inferior gluteal artery. So this is where you see this anastomosis created at this region. So in summary, the deep branch of the superior gluteal artery will be seen to subdivide into a superior branch and an inferior branch. The superior branch will be seen to create anastomosis with other vessels around the iliac region here, created at this upper end. At the lower end here, you have the inferior branch, also creating an anastomosis with vessels also around the truncator of the femur. So this is how this presentation goes. So thanks for watching this video. Let's continue to stay glued to this channel.